Hello viewers, welcome to our FB Live session. Today we have with us Dr. Rajesh Shinde. He is a professor of surgical oncology and consultant gastrointestinal and HPV surgeon at Apollo Cancer Centers, Navi Mumbai. Today we will discuss about pancreatic cancer. Look, my first question is, what is pancreatic cancer?
So pancreas is a very important organ or a gland in our body. It lies in the retroperitoneum. It is a unique organ which has both exocrine and endocrine functions. When the neoplastic process involves the pancreatic gland, it results in the formation of pancreatic tumor or pancreatic cancer. Globally, we see around 5 lakhs cancer patients developing pancreatic cancers every year. Unfortunately, around 4.5 lakhs of those cancer patients succumb to this deadly disease. So, in other words, pancreatic cancer is a very aggressive form of malignancy to detect and to treat. So, there are certain risk factors which are responsible for development of this cancer. These are smoking, alcohol intake, obesity, physical inactivity, and some sort of genetic conditions.
Doctor, is pancreatic cancer is a genetic disease?
Yes, around 10% of the pancreatic cancer are hereditary. This means 1 out of 10 patients with pancreatic cancer has a likelihood of inheritance of a genetic mutation which has resulted in the development of pancreatic cancers. These mutations are responsible for some syndromes which increase the possibility of development of pancreatic cancers. These syndromes are familial breast and ovarian cancer syndrome, familial polyposis coli, Peutz-Jeghers syndrome, HNPCC, hereditary pancreatitis, and cystic fibrosis.
So, what are the early signs of pancreatic cancer?
So the signs and symptoms of pancreatic cancer depends on the location of the tumor in the pancreas. Anatomically, pancreas is divided into head, neck, body and tail. Unfortunately, most of the pancreatic cancer patients are detected in advanced stages because the signs and symptoms are either not there or they are neglected. So, for example, if the patient has the tumor in the body and tail, this patient might have a recent onset diabetes mellitus, loss of appetite and loss of weight. If the patients have tumor in the head, these patients might present with a jaundice because of the obstruction to the bile flow.
Doctor, what tests are available to detect pancreatic cancer?
So, for the detection of pancreatic cancer, the only thing which we need is a good quality pancreas protocol contrast enhanced CT scan of the abdomen and the pelvis, which will tell us about the location of the tumor, extent of the tumor, and its relation with the surrounding structures. It will also tell us about the spread outside the pancreas. There are other tests which are used as a supplement to the diagnosis of pancreatic cancer like CA19-9 and CEA.
Doctor, what are the treatment options?
The treatment of the pancreatic cancer depends on the stage at which it is diagnosed. Generally, if the pancreatic cancer is diagnosed in early stages, surgery is the best and the most effective treatment against pancreatic cancer. If the diagnosis is made in a locally advanced stage, then we might offer some sort of neoadjuvant therapy in the form of chemotherapy or radiotherapy. If the patients are diagnosed in a more advanced stage or a metastatic stage, then only palliative chemotherapy is offered. Surgery also depends on the extent of the surgery, or the type of the surgery also depends on the location of the tumor in the pancreas.
Doctor, is it possible to have full recovery from pancreatic cancer?
Yes, definitely. If detected early and treated properly with surgery, chemotherapy, plus minus radiotherapy, full recovery from the pancreatic cancer is very much possible. Thank you.